My name's Luke. I'm a physiotherapist. I'm working at Life Ready Physiotherapy in the Perth CBD. I have 15 years of pain management and musculoskeletal injury management experience. I'm very passionate about the area and I'm happy to be here today to share some knowledge with you.
Well, Luke, thanks for joining us. In the Resilient Shield book, we talk about the importance of everyone, including veterans, being able to perform minor maintenance on themselves using bands, rollers, stretching. What's the physio's view of that?
I think from a physio perspective, I'd be very reluctant to dive straight into rolling out your back and doing band stretches and releasing muscles with a massage ball without a true assessment behind it. Because the issue with, say, banded stretches is if you've got neural irritation or an irritation of that sciatic nerve and you're doing some really strong stretching through your leg, you can irritate that nerve and create a higher pain response. So what you'd want to be careful with is making sure that those exercises are targeted specifically to your individual needs, and you can get that through a physio assessment.
Awesome. So an individualised program to my unique needs, my challenges, the things that I must do in order to provide that urgent minor maintenance. So how do we get access to a physio, and what's the role of the physio in this partnership?
Right, to get access, particularly as a veteran, if you've got a DVA gold card or a white card, you can go straight to your GP and they can refer straight to a physio, and then we can tailor that program towards your specific needs. The role of the physio, I think I'll answer that by just explaining what you'd expect when you come and see a physio. So you come in and we perform a bit of an interview process, much like this one, and we want to understand you as a whole person. So we're trying to take in a bit of a timeline of events and really have an understanding of what started your journey leading up to the point where you are now that brought you in to see us in the first place. So that'll cover biological questions, psychological, social, environmental, workplace. So there's lots of different factors that might contribute to any given condition. We then conduct a physical assessment where we're looking at that functional task you're having an issue with, and we perform range of motion tests, strength tests, muscle length tests, a variety of physical assessments to determine what the main contributors are, and then work with you to generate a management plan to address those.
Is it necessary to wait until I've hurt myself to see a physio? Is there a proactive way that I can stay ahead of injuries?
I would say absolutely there is. I think the main thing to stay ahead of injuries, I mean obviously if you're really wanting to learn more about that approach and aspect of it, you can come and see a physio to discuss those needs. But I think there's a number of things you can do to benefit your health before you even need to see a physiotherapist to prevent injury in the first place. And I'll explain those. The first thing I would do is really focus in on sleep quality. I think you mentioned it in your book, that body layer is really reliant on getting a good quality sleep, because if you're sleep deprived in any way, that can really amp up that stress response system or the central nervous system activity, and that cortisol will just be rushing through your system all the time. So you're in this fight-flight mode, which also has a big impact on pain sensitivity. So if you're suffering from a condition that gives you persistent pain and you're sleep deprived, your pain irritability is going to be so much higher than what it could be. So I think simple things like incorporating going to bed and waking up at the same time every day, no screens, particularly with that blue light, an hour, 2 hours before you go to sleep, reducing caffeine intake in the afternoon. Those sort of simple things can help. But if it's bigger than that and you're still waking up with fatigue, then go and see your GP for some extra tests and figure it out that way. The next thing would be the diaphragmatic breathing, or slowing down that breathing. So in times of high anxiety or high stress, one of the first things that we do physiologically is increase our respiratory rate. So if we're breathing fast and using an upper chest breathing pattern, we're really, again, activating the sympathetic nervous system, which increases that cortisol release. You talk about box breathing in the book, where you breathe in for 4, hold for 4, out for 4, hold for 4, which is specifically designed to slow down that breathing response. In the physio world, we use, some of us use a Bradcliffe breathing method, which is designed to normalise the breathing pattern, basically. So your normal inspiratory expiratory ratio is 1 to 2. So if you breathe in for 3 seconds, ideally what we'd do is breathe out for 6, pause, and then breathe in again. That's a normal breathing pattern, and that'll allow your respiratory rate to be around that 10 to 12 mark, which just calms the system down a little bit and allows you to deal with stress a little bit more in terms of that system. There's a really good technique and some really good tips there. Breathing through your nose, breathing low, breathing slow, using that diaphragm effectively. And I suppose the third thing is just moving your body more. And I think the World Health Organization recommends the 150 minutes of moderate intensity exercise per week, 2 of those sessions being resistance training. But if you're starting from 0, say you're a returned veteran and haven't exercised at all because of previous injuries or whatever reason for years, and you're wanting to start getting back into this, that 150 minutes might be fairly overwhelming. So I would suggest just thinking about what you enjoy doing and just getting your body moving in some way to start with. So whether it be a 10-minute walk every day to start with, at least you can build on that and just form those habits early. If you like swimming, set up 2 days in the week where you're going down to the pool and getting a swim in. It doesn't matter what you do, as long as you're moving your body in some way. I think that would have a better health benefit than rolling around on a roller, not knowing what you're doing to start with.
So consistency versus intensity. You're suggesting that it's really all about consistency, whereas for a lot of veterans in our military careers, a lot of the physical training was about intensity. So we've got to deprogram that in order just to be consistent and a bit more gentle.
Absolutely. And I think the big difference there is in active service, you have to be on high alert all the time. Like that's a requirement. So you want to be exercising and bringing your system up to that point a lot of the time, whereas in civilian life, you just got to calm it down a little bit and reset it all. And that's a really hard thing to do. For anyone who is always in that high stress environment, for people going through childhood traumas, for example, to bring yourself down to a level where you're at this nice calm state is actually a really difficult thing to do because you have to rewire the brain in order to do it. But it's a good process and a very beneficial one if you can achieve it.
Now you've treated me, you know I'm far from an elite specimen. But one of the things that you do is some alternate therapies or perhaps non-conventional therapies, and a lot of veterans wouldn't have ever come across, like dry needling. Can you explain what is dry needling, how it's used, and how we wouldn't be fearful of it?
Yes. Well, so dry needling in itself is really an adjunct to what we're trying to achieve. Obviously, we want you to have an active approach to pain management or injury management every single time. You, for example, if you have tightness or weakness in a certain area, dry needling...
Which is rare for me.
Very rare. Well, it definitely wasn't weakness, tightness. We can use some dry needling purely as a muscle release technique. So the idea of using like a dry needle to activate a twitch response within the muscle can help normalise the muscle tone and release that muscle, the same as massage would, just in a more direct and specific way. But you wouldn't want to rely purely on dry needling. So you might have that, and then I'd prescribe you, say, some strengthening exercises if fatigue was the reason the muscle was tight, and then you'd progress to that functional task that you're trying to achieve by running marathons all over the world.
Luke, a lot of veterans deal with chronic pain. Maybe don't really understand what chronic pain is. Could you explain it and how we treat it?
Yes, so chronic pain in itself is basically a descriptor of how long the pain has been there. So the word chronic basically means more than 3 months. So a normal healing time frame of any given injury is around about that 12-week mark. So any muscle, ligament, disc in the back, those sort of things will all recover conservatively or by themselves within the 12 weeks. If your pain persists longer than 12 weeks, people then class that as chronic pain. In the physio world, we're trying to move away from the word chronic because it sounds threatening and into more persistent. So when pain is more persistent, often the healing process has taken place, but people are still experiencing pain. And that can be because of a number of different factors. And those factors include the biological factors, so maybe there's some changes in the soft tissue around that area. There can be psychological factors where Fear and anxiety with certain movements can create movement patterns that exacerbate pain and start causing that cycle to continue, where those pain receptors are constantly activated. The reason for that is because pain in itself is purely an experience, generated 100% of time from the brain and the central nervous system. So if our brain is in a state of heightened activity, so that stress response system is constantly on the go, every experience that we have with the environment and with ourselves is heightened. So if that initial pain experience was extreme, which can be the case with a lot of veterans, plus you have a number of mental health issues along with that, like high stress, high anxiety, PTSD, all of those things can really exacerbate that pain response and continue it going. The other factors can include social factors, so your social environment can have a huge impact on your pain experience, and your own experience and your own beliefs. So we want to encompass all of that when we're talking about persistent pain, try to address the factors that most contribute to that given condition in that individual.
Now, we often talk that there's no one layer acts truly independently, that there's this network, a bit like the underside of a carpet, the strength of the weave of all of those layers contributes. And you've been talking about the mind-body connection. How much might be mind for someone coming into a physio, how much might be body?
Well, it all depends, but I do feel like that the mind and body can't work individually anyway. So anything that happens within your body has a direct influence on what happens in the mind and vice versa. So in order for us to address what's happening in that body layer, in terms of the way you move, postures you adopt, exercise that you do, you have to incorporate the mind at the same time, because if you don't, that risk of increased injury is there. So you've got to be able to marry the two, yeah, as well as the other layers as well. There's a real biopsychosocial, environmental, experiential model that should be adopted with everyone.